Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Good morning, everyone. Thank you for joining us for today's Home Healthcare News Staffing Summit and this morning's panel discussion entitled Uberizing Clinicians, Scheduling Flexibility Puts Nurses in the Home Health Driver's Seat. Axxess is delighted to be a Home Healthcare News thought leadership sponsor and share a unique approach with you today to address our collective workforce challenges. We hope you've come with an open mind and you're willing to consider an entirely new care delivery paradigm, leveraging handheld technology and virtual caregiver training and certification to create a ready, willing, trained, and diverse and limitless 24/7 workforce. Hello, my name is Deborah Hoyt, and I'm Senior Vice President of Public Policy at Axxess. And it's my pleasure to introduce our panelists who are my friends and colleagues. First is Tammy Ross. She's Senior Vice President of Professional Services. And we also have Arlene Maxim. Arlene is Senior Vice President of Clinical Services. Both Tammy and Arlene are nurse leaders at Axxess with decades of experience sitting in the exact same seat where you're sitting today. They've been former home health agency operators and industry consultants. So good morning, ladies.
Morning, Deb.
Hi, Tammy. Hi, Arlene. Great to see you. So
nice to see you.
Our guests are here. We're presenting live. We actually welcome your questions and comments through the Q&A box. We're not doing a PowerPoint presentation. We're having a casual conversation, but we will make every effort to address your questions as they come in, or we will reach out to you after the conclusion of the webinar if we don't have an opportunity to answer them. So we'll be going live for 45 minutes this morning and hope you enjoy our conversation. So let's begin by first discussing major market shifts and disruptors. In every industry, technology advancements have always been a disruptor. So the disruptor in healthcare is the educated consumer. Consumers of all ages understand that they can now receive healthcare in the home for most of their situations. Therefore, it's natural that consumers are demanding an anytime, anywhere, 24/7 home-based care model, much like how the transportation industry was transformed by Uber and the meal delivery system by DoorDash. So we're behind those industries, and we know that technology can help us move us to the next level and answer and solve for some of the problems we're struggling with today. So technology companies like Axxess have been preparing for the workforce and nursing shortage for decades. And Axxess has created the technology now to move our industry forward, to empower the caregiver and meet the growing referral volume that all of you are seeing as provider agencies. So I'm going to start with Arlene. Let's begin with you. We've heard about the Great Resignation, right? And the significant volume of nurse retirements nationwide. And how can we apply a modern strategic and data-driven approach to leveraging nurses and caregiver geographic distribution to solve for this shortage that we're hearing about? And this is something that's going to be with us for the next 10 years. So Arlene's been our leader at Axxess. She's been leading what we're calling our Axxess CARE system, which is really the Uberization of in-home care staffing to meet consumer demand and address provider staffing challenges, but most importantly, provide flexible job opportunities for those people out in the field. So Arlene, tell us a little bit about this, what you've been working on, how it's rolling out, and what's the receptivity of the caregivers and the provider agencies.
Well, thank you, Deb. And this is a brand new type of nursing being done. And the Uberization of this application is just an absolutely wonderful idea that our CEO at Axxess, John Alajade, came up with a number of years ago. And we've been working on this for a number of years. It is not a staffing agency. And I want to make sure I make that very clear. It's an application. So it's an app just like you get for Uber that will allow agencies to order up nursing whenever they need it. They can also use it for a scheduling system. But the problem we found with, as COVID hit us most recently in the past couple of years, we found that we lost nurses more quickly than we thought we would be losing nurses. And there's such a shortage, and there continues to be a shortage. This is going to go on for another 10 years, as you mentioned. The retirement of nurses is going to speed up. We have fewer and fewer folks in the workforce, and this is going to help alleviate and augment the staff that organizations already have in place. I've heard stories about agencies losing revenue through loss of referrals that are multipliers of their 75 to 100 referrals they're turning down in any given week. And that's lost revenue that agencies just can't afford to with all the cuts that we're coming up with now. So with the application, an agency can actually look for a nurse. We have a mapping piece that they can take a look at. They can see where the nurses are. I think this is a great tool for getting like PRN staff out to the home. So for instance, if you have an emergency, if you have perhaps a patient has a catheter that falls out or something needs to be replaced, you can take a look at that map, see where that nurse, where a nurse is, and you can order that nurse immediately, and she can probably be there in a matter of minutes. So the advantage that this gives organizations is just absolutely tremendous. And the geographic positioning of the maps and knowing where clinicians are in relationship to patients and also the organization is just tremendous. Now, as we get into at the end of this month, I'm really, really excited about having Axxess certification available. And I know Tammy's going to talk about that. That's going to give many more nurses, whether they're retired nurses that would like to come out of retirement or nurses who are working in hospitals and that type of thing, they'll be able to come into the Axxess CARE family and use that application to pick up extra shifts. They can do that. They can pick up as many shifts as they want. And we have to realize that our nurses and our therapists are not, they're not computers, and we can't expect them to be working and taking on 14 to 15 visits a day. And I've heard from some pretty good sources that that's what's happening throughout the United States. And it's a safety factor along with causing burnout with the staff. So the Axxess CARE application can be a solution for many, many organizations. And we're going to be really excited to open it up to the clinicians across the United States by the end of this month. And I know Tammy's going to get into more of that. But the application, I just want everybody to understand this is not a staffing relief operation. It's an application. So it is something that every organization can take part in. And the clinicians will be able to have access to the application as they go through the Axxess certification program that Tammy's going to talk about.
Thanks, Arlene. So this is interesting. So basically, this Uberization of the workforce, nurses, clinicians, therapists. So I'm just trying to get my head around this myself. Yes. So if I was a clinician and I wanted to become part of this Axxess CARE, just like yes. a Uber driver, right? Do I have to tell me about how I have to be qualified or certified? What do I need to know? Is there background checks done? I mean, how do I get on this app? And then do I choose my own? Am I in the driver's seat so I can choose my own visits? And then I'm not replacing agencies, right? Agencies can tap into me and show me what visits are available, and then I can go on them. Tell me a little bit about how.
That's correct. Yeah, that's a really good question, Deb. Thank you so much for asking that. Yes, the nurses and therapists, I want to make sure that we remember that therapists can also utilize the application, can get on use the application, and they complete a profile. So we have the pre-loaded profile that they complete. They go through a complete background check. Axxess CARE does the background check. So that is all available for the home care agencies as they look at the clinicians, so that the staff that are available on the Axxess CARE app are all pre-qualified. They have a skill set available so that organizations can take a look at that. So if they are interested in doing primarily wound care, they're going to be able to do that. But they're all vetted prior to being accessible on the application. So agencies don't have to be concerned about that. Their licenses are checked. Everything's done prior to placing them as availability on the application. The nurses then can, and therapists can take the application and sign up for as many visits as they would like to do in a week or in a month. So they have full flexibility and they're absolutely in control. They are in the driver's seat for this. So they can pick up as many visits as they would like. Or not. We do have a couple agencies, I believe in Florida, that do actually shift work as well. So we have nurses that are looking for taking care of patients at a longer period of time, not just intermittent care as we do with certified care, but that is also available. But it's just an absolutely tremendous a gift to agencies to have this available. And it's also free. And I think we forgot to mention that that's a free application. Organizations don't even have to pay for it. So for now, this is something brand new in the industry. And I'm hoping folks will take a look at it and really take this seriously. And it's really going to help with retention. It's going to help with recruitment, knowing that agencies can have availability on weekends. Oftentimes, I can remember being a manager in home care agencies, and being on call on weekends was the most challenging thing we had to do within our work week, is making sure that we had folks available on weekends. This is a great augmentation to your current staff and being able to pick up work on the weekends or on holidays. That's also available too. And the organizations can pick and choose. They'll have options to take a look at, so they don't have to take every single nurse that's on the application. They're able to screen them as well. They can take a look at their profiles and see if there's some clinicians that they would rather have than others. Geographically, it makes sense because they can find folks that are closer to where they need the work done so that mileage is decreased. And right now, as we know, with gas prices the way they are, that's going to be a big deal. And that is a big deal. And so there's so many advantages to Axxess CARE, to the Axxess CARE application. And as I mentioned before, we're really excited about May 31st being a kickoff date for all clinicians across the United States to be able to access Axxess CARE.
Thanks, Arlene. And I guess I just had two little follow-up questions. So when you were talking about agencies, home health agencies, home care agencies, needing these clinicians or workers to fill these shifts, if I was a clinician on this app, could I work for a VNA on this side of town and work for, a large enterprise provider agency on this side of town, work for multiple agencies? And, how does that work with the documentation? Do I document everything right through the app? And then this way, once I complete the visit, I indicate it's completed, and then do I get paid through the app? Or I just am curious as to how do we create the worker satisfaction so they have the flexibility and maybe,
Exactly. Yeah.
the opportunities they like.
Yeah. Those are really good questions. The application, yes, everything is done through the application. They can work for as many agencies as they want. Now, right now, and Tammy might be able to clarify this, but right now, the availability of agencies are only agencies that are using the Axxess platform. So that's one thing that we need to consider. As far as pay is concerned, all the payment goes right through the home care agency. But what the really nice thing about this is that the clinicians are paid right away. They don't have to wait for 2 weeks or 60 days to get, or 30 days to get paid. They are paid right away as soon as the quality assurance is done on the clinical records and with the documentation that's available to them. And with the Axxess platform itself, we have so many opportunities for education that the clinicians can keep up with their educational opportunities. And as Tammy will talk about, the certification program is just amazing. And so that's going to give access to many, many more clinicians. But yes, the payment is through the application. The agency has the ability, as long as they're an Axxess client, they have the availability to use the Axxess CARE application. And soon we're going to expand that.
Thank you, Arlene. I really appreciate that overview, so that now when we move into Tammy's conversation about the Axxess certification program, Tammy's going to talk about how these clinicians become, fully educated and certified to be able to be independent and out on the road to use this technology. But we want to also emphasize the fact that provider agencies have been partnering with the community colleges and universities in their towns, in a very dynamic way with preceptor programs to try to build up the workforce. It's just that we need thousands and thousands of workers, and we can just never get to where we need to be using that old paradigm. That's why you've been talking about how technology has been able to create a new opportunity to work side by side with that. So Tammy, tell us a little bit about, how COVID has launched the Axxess certification program and kind of how that was born out of that thinking.
Sure, Deb, thank you. So I think we all remember back to 2020 and emergency waivers were put in place because we really, the focus was care in the home. We really wanted to push COVID patients into the hospital, and those that could stay at home, we wanted to push those into the home environments. And it was a true shift of resources. A couple of waivers I want to mention. There was a waiver that clinicians could cross state lines. A lot of clinicians, therapists, and nurses, you're restricted to practice in the state which you're licensed. Unless you have reciprocity, and there's over 30 states that have that. But what this allowed clinicians to do was cross state lines. And the reason why, we know New York had the biggest area, right, that really had the COVID outbreak. So that was one waiver. Another waiver was that nurses did not even need to be boarded yet. In other words, they didn't need to take their boards yet. We were going to take nurse graduates and put them in home care. So that was two pretty major pieces of legislation and waivers that were put in place. Unfortunately, because home care at home is very specialized, nurses did not feel comfortable actually going into the home that had never done home visits before. So they were not deployed in the masses that we had hoped when this waiver happened. So this really caused us to ponder and think about, what's next in the industry. And Arlene mentioned the Axxess CEO, John Alaj. We actually had a conversation where he wanted to solve for this. And the way to really solve for that is being able to remote onboard nurses across the country, and actually across globally, any country, efficiently and effectively, and make sure that they understood regulations and they understood compliance, and they could truly become a home health nurse online. Remember that redistribution of the workforce. That's how certification was actually born. And we deployed quite a few resources, therapists, nurses, IT specialists, engineers, to begin working on this certification program. It took us a little over 9 months to get our first beta project ready. And we actually tested it out on a group of employees first. In fact, every Axxess employee is certified in home health, hospice, and home care. We had some really great feedback from that. And we understood that one thing about pandemics is they are emergencies. It causes us to look at things for speed. So when we looked at our certification program, we really wanted to focus in and condense the seat time. We call that seat time as the amount of time it actually takes you to sit down and take those courses. We wanted it to be very mobile and user-friendly and be delivered in small chunks of information. So we kind of revamped our program a bit. We reduced that seat time. We added continuing education because for nurses and therapists, that's a real big professional development value is to get continuing education. There's actually 64 hours of CEUs in the program. So we added that on and redid our program a little bit, made it more user-friendly, and decided, you know what, once we marry this up with Axxess CARE, we have the perfect solution for that staffing redistribution. We have a way to train those nurses that might have retired. We have a way to train nurses that maybe were acute care nurses and now they want something more flexible. They don't want to be stuck in brick and mortar 12, 16 hours a day. The one thing that I'm happy that COVID did is it really put a point on work-life balance. You know, there's really a focus on focusing on the family, but focusing on your work too. And how can the two meet together to really promote retention? That's what certification in Axxess CARE does. It allows flexibility. Arlene mentioned you can work anywhere you want to, so you can define your location, just kind of like Uber drivers do. They define where they want to work. You can work any hours that you want to work. Weekends, perhaps when your husband or your wife is working is when you pick up shifts, so you can save those daycare costs. Perhaps you want to pick up night shift, all sorts of different flexible scheduling, and it really is driven by the person. The other thing that allows us to do is specialty programs through Axxess certification. There's specialty training in wound care, IV therapy, pediatrics. So the nurse can really hone in and still do what she loves to do and be certified to do that. I'm really proud of that. Arlene mentioned that May 31st date. That's our official launch date. So announcing it first here during this webinar, it's going to be completely free to the industry. In fact, it's completely free to anyone, Deb. We have other people that maybe are paraprofessionals that want to join Care at Home. We also have billers, administration people. There's a wide variety of positions, and certification trains for all of those. It launches on the 31st. That's a holiday, so it may be a little slow. I expect June 1st to see a lot of people jumping on our platform, getting this free professional development. Also, you know, maybe launching a new career. So very, very excited about it, and look for more to come on that and take advantage of it.
Tammy, thank you. Thanks for your leadership on it. I know you've been a nurse for so many years and you created the curriculum that people are taking. I actually went through that: home health, hospice, and home care, all of those 100 and some odd modules. And it was very eye-opening to me, and not being a clinician or a nurse, you know, really understanding not just the documentation and the technology, the handheld technology to be able to do that visit, but understand the regulations and the license and all of those things that go to making sure that you have a quality caregiving experience. There were a couple of questions, and I think Arlene answered one. Someone asked about charting with each organization's EMRs. How is that proposed to be dealt with? And I think Arlene answered it by saying, this is an Axxess app platform. And right now, all of this, you know, the documentation, the QA, the direct billing to CMS and others is only through the Axxess app, and only if that agency has access, correct? Is that correct?
Yes, that's correct.
Okay. Yeah. The other thing, Arlene, was they said, what about compensation for the caregivers? How is that accomplished? So tell me a little bit about, if I'm a caregiver, I create a profile. Am I putting my bank account in there, like for direct deposit? How does that work?
Yes, all of that. Yeah, thanks, Deb. Yeah, and that's a really good question. All of that gets included when they set up their profile. All that information is included. And then the pay actually goes through the home care agency. And as I mentioned, the payment for the visit is done very quickly because as soon as the quality assurance folks in the organization complete the review of the documentation, then the clinician gets paid right away. So it's all done through the application, the charting, everything is done through the app. It's all handheld. They can use their computers if they'd like, but I think the beauty of it is that you can do it all with having access to your telephone.
Right.
Arlene, can I add to that? Because I think one thing that I'm really impressed about, very much like Uber, they have their prime time rating. Organizations are able to set the rate of that compensation. So it could vary, Deb, it could really vary from, what that person is going to be paid based on what that organization sets. The beauty of that is that nurse can pick and choose. If that's not the pay that they want, they don't need to do that visit. Maybe they could look for a higher pay. So there's a lot of flexibility in there. As a former operator of a pretty large organization with agencies across about 6 states, I spent a lot of time on Friday beg, borrowing, and stealing. If I had 2 nurses to do visits on the weekend, and even incentivizing them, I'll give you $50 extra if you can do these starter cares. I'll give you $25 extra if you'll drive a little bit further away from the office. This is all done through that app. Organizations can just set that pay on there. So nurses see that, what I would call incentive pay, and pick and choose.
I love that, Tammy. And Arlene, you had mentioned something before about, this is all geographic driven. So what we're not looking at is a nursing shortage. Some areas of the country, there's actually surplus and there's opportunity to grow that workforce, like Tammy said, through certification and educating people. So there's some questions here around 1099 RNs and 1099 CNAs. How does that play into it? What about taxes? How does Axxess handle that? Go ahead.
So Axxess is not the employer. Axxess is only providing the application. So each clinician that is working with the application is an independent contractor. So they would be responsible for their own taxes. They would be responsible for making sure they're set up. They can set up their own little business as a nurse clinician, and they would be paid on a 1099. So that's another thing that I think organizations need to think about, is that we can provide the best care possible to our patients while saving money. I know some states, the payroll taxes are just astronomical. And so with using the clinicians with the application, you can save some money there with payroll costs. I would caution the organizations to make sure that when they're looking at using the application, they're making sure that they don't have nursing or therapy down as their primary source of employment with their company. Medicare requires that you have one primary source of an employee. And so many times people choose speech therapy because we don't use much speech therapy. So you want to make sure that you're able to contract with nurses and therapists. So, but it's purely driven through the application.
Excellent, Arlene. Thank you. So I'm really happy that we're seeing so many questions come in, and this plays into some of the things you've been talking about. Arlene, you said, if I'm a clinician and I want to create a profile and get on the app, what if I live half the year, in North Carolina because I have a beach home there and I want to pick up visits there, and then the rest of the year I live in California? Can I do that? And, can I just tap into visits in whatever geography I'm in?
Well, as long as you have a nursing license, your license is accommodating that. There are many compact licenses now that accommodate multiple states. So you would have to look into your state to make sure that you can that can be applied to it. But I think the other really interesting thing about this whole application process is it's kind of like some of us gotten used to the traveling nurse type of thing. This is kind of like a traveling nurse, but on a local basis for many nurses. And again, they're 1099 employees, they're contracts. So you need to make sure you're set up. The nurses need to make sure they're set up as a small business. And they can then use that. I mean, there's a lot of tax advantages to doing something like that. And I think nurses can take advantage of that. And setting up your own little business is really a fun little thing to do. And while maintaining an income that you need, sometimes there, like Christmas time and that type of thing, there are times that you want a little more income so that you have that flexibility to pick up on that. But I think many of the nurses and therapists that get involved with the application just absolutely love it. We have every year we do a clinician of the year. We also do clinicians of the month, and the clinicians of the month are issued a gift card for gasoline. It's a gas card that they're issued. The clinician of the year has a monetary settlement for that. And so we have things that the application gives an advantage to the clinicians, but it's really, like Tammy said, it just offers so much flexibility. And we know that I think we're going to see an increase in the number of patients who are refusing to go to be institutionalized. And we're going to see more and more patients who are demanding to stay at home. And so the demand for all of us is going to increase. And so this is a way to do that. The other thing I did not mention is that organizations that use the Axxess CARE application for scheduling can also take a look at the clinicians as they're working and almost kind of look at them as possibly becoming their own employees, almost like a recruitment type of thing. So that gives an advantage to the employer, the agency, to determine whether or not they would like to have that person on as a staff member. And there's no reason they can't do that. So.
Hey, Arlene, if I could just mention on that reminded me of something. Even though most of our folks on the platform are 99, a lot of them can be employees as well. It's really the organizations, how they choose to set it up.
Yeah.
We want to accommodate for both of those. And so within certification, like you said, the little mini business, the ones that are the 1099 contracts, we actually have a program within certification to teach clinicians how to be a mini business and be a 1099 employee should the organization they work for choose to list them as a 1099. Obviously, if they choose to list them as an employee, you don't have to do the same things, but we did try to accommodate that training because you're right, Arlene, it's exciting and it's fun. There's a ton of tax advantages for our clinicians and therapists.
Tammy and Arlene, the questions just keep coming in, and I'm trying to see which ones we should pick first relative to what you were just speaking about. So there's been a lot about 1099s documenting, for tax purposes. Can an agency reject or block a specific clinician if there's issues?
Sure.
Okay.
Sure. Yeah, absolutely. Yeah, they can. I mean, they're the ones that are going to make the choice. The clinician does not sign up and just assume they're going to pick up that work. They're going to get a notice to say they've been accepted. And as Tammy mentioned too, I just think that this is a tremendous way for organizations to reduce the workload on their schedulers, because if they use the application as their scheduling system, and everything is automatically done, so that you don't have that consistent phone calling saying, "Can you please pick up this visit?" Everything is done using technology. And so scheduling, like Tammy said, their own employees can be done through the application, through the scheduling platform.
Thank you.
The star rating, I think, is a big deal. Just
True.
when you think about the star rating, and how many trips they've performed. You can see the star rating for our clinicians too, right in the app. So obviously you want to look for those clinicians that have those 5-star ratings. You want to look for clinicians that meet the skill set that you want, so you can do a matching. If it's a wound care patient, you're looking for a nurse that's competent in wound care, and that's one of her skill competencies.
Mm-hmm.
Matching criteria as well.
Thank you, Tammy. So Arlene, there's a question here. Kimberly says, what is the name of the app and how do we find it? So I guess if you're a provider, how do you get engaged or get involved with getting on this platform so that you can see who's out there?
It's Axxess CARE, and they can, it's online, so they can just get online and look for the Axxess CARE application and everything. And certainly the Axxess, if they're working for an Axxess organization, it's going to be on their website or on the site for the agency. But the Axxess CARE application information is online.
Thanks, Arlene. Tammy, there's a good question for you here. How is patient continuity managed when a visit is assigned to a new nurse? And we know that people in the home like to see, the same caregiver come back. How do you manage this, or what do you think about this as a long-term solution?
Yeah, certainly. So I like that about patient continuity. What I want to say is, I think it's managed just as well as it is in our organizations now. When we are pulling out a director of nursing or clinical services or a supervisor to go do visits, because we don't have adequate staffing. And I love the fact of having one nurse to one patient all the way throughout the episode. I think that's best practice. Obviously, we know it can't always happen, but a lot of organizations using Axxess CARE will request that same nurse all the way throughout. Mm-hmm. 5 people apply to do those visits. They're going to pick that nurse for continuity of care, and they're able to see who's done those prior visits. So it's really technology enhanced scheduling. Those are going to be the nurses that are listed first to actually handle the care.
Thanks, Tammy. And a follow-up to that, the question is, let's see, how are supervisory visits made to assure for high quality of care delivery? I know both of you as longtime nurses are so focused on high quality of care, star ratings, and outcomes. So Tammy, let's start with you, and then Arlene, if you'd like to add.
Sure. So a couple of things. That's going to be per your policy as an organization. Just like when you use any per diem staff, you have to think of this as per diem staff or a staffing contractor or travel nurse. You have to validate their on-site competencies. You have to validate their care the way your organization is set up to do so. Some things we do to enhance that through technology, right through the Axxess CARE app, you're able to call that nurse or that therapist, have a conversation with them and say, hey, can you meet me at the office, or can I come out and meet you at the house on your first visit, to establish that competency. And again, it's per policy. Our technology does enhance that through competency validation checks. And those are pretty much self filled out, where you say what you're competent in and what you're not competent in. We list that for you. We package that in a little mini HR file for you and maintain that on the app. So you're able to see immediately everything that the clinician is competent in. If they have selected that they don't have competencies in a certain skill set, let's just say IVs, because that's one that sometimes people have some issues with. They would never be matched for an IV visit through the technology. So you can be ensured that anybody you use will have those competencies before they're matched for a visit.
Thanks, Tammy.
Right, okay. I might have missed some things there.
Anything to add, Arlene, or you're?
Well, I just think that folks need to think about how they use contract therapists right now. I know they're almost every agency uses contract therapy. The money they can save through using the Axxess CARE app for their therapy needs is tremendous. And as Tammy mentioned, the supervision is going to have to be done according to their policy for contract staff. And so the supervision, however you have it outlined in your policy manuals, are going to have to be reflected in the personnel files that are kept up. And looking at the star ratings, as Tammy mentioned, is a really good way to determine competency in many areas. But it's such a cost savings for home care companies that I just don't know why any agency would not be using the application, particularly now with the shortages that we have in the industry in general. Thank you.
So 2 more questions, I think, and then we're at time. Arlene, can you do like a start of care, a full OASIS? You know, is this full documentation? It goes through QA, goes to billing. I mean, is that all available on the app? And is that the required protocol for any caregiver that accepts that assignment?
Well, that will be on their skills checklist, but yeah. There are many agencies that use Axxess CARE clinicians to do their OASIS assessments. As a matter of fact, I found a number of agencies contacted us and let us know that they're actually getting better documentation through the application of OASIS through the app by the nurses that they're using to do start of care assessments. But they are all qualified to do that. We're building, I believe, Tammy, correct me if I'm wrong, but we're building OASIS E information so that there will be training in OASIS E. And we also have partnered with Decision Health. So many of the clinicians will be certified through the Decision Health OASIS and the coding programs through there. But yes, OASIS can be done. And as Tammy mentioned, any of the specialties, the agency would be able to screen clinicians for specialties as well.
And Arlene, just to tag on just a little bit, because certification's open to the public. We do a 15-minute OASIS walk through certification that's really fun and interactive. And I think that's daunting for people to think about OASIS new to the industry, but this really is done in 15 minutes and teaches your staff how to do that same 15 minutes to answer 90% of OASIS questions.
Thanks, Tammy. And we've got one last question, and then I want to leave everybody with the name of the app again and the email address for both of you. Is that okay?
Sure.
Good. So real quick, Tammy, I'll put it to you. Someone says, how does this work for an agency that has ACHE accreditation or maybe CHAP accreditation that has higher requirements for staff upon hire, their charting, education, et cetera?
Yeah, so I'm proud to announce that we are CHAP verified. We are the only technology company that has been verified by CHAP. We are also looking to be ACHC verified as well as Joint Commission verified. So it works for all accreditation bodies. Again, you have to combine technology with your own operations, your own policies, and validate those competencies and on-site supervisions accordingly. Arlene, could you add anything to that? Does that make think that?
No, I think folks can be comfortable knowing that if they're using an Axxess CARE clinician that's gone through the certification program, they're probably going to do better than most clinicians out there. One of the beauties of the certification program is that we've pulled in regulation along with documentation, so you know why we do certain things. I think many times with the home care staff, they do it because somebody told them to do it, but they don't know why they do it. And so the certification brings all of that out. So the quality of the documentation and the understanding, the reasoning behind it is going to be much more clear for those clinicians that go through that certification program, which makes them a better Axxess CARE nurse or therapist.
Thank you, Arlene. Thanks, Tammy. Thank you, everybody. So we really didn't get through what we were planning to talk about. We were so happy to receive all of these questions that kind of drove the conversation. So we appreciate it greatly. So just to let you know, we'll leave you with the information. It's Axxess CARE, AXXESS CARE, CARE. That's the name of the app. And we hope that this is going to drive the future of healthcare delivery in the home and create a flexible 24/7 workforce that's going to meet the providers and the consumers' needs, as well as the caregivers' flexibility. If you'd like to reach out to Tammy Ross or Arlene Maxim, it's tross@axxess.com or Maxim, MAXIM, @axxess.com. So we thank you so much for joining us today. If you have any questions, reach out to us at Axxess. We're always here to help and educate. We have all kinds of information on our website for you if you'd like to learn a little bit more. So have a wonderful day, everybody. Thank you, Tammy. Thank you, Arlene, for your time.
Thank you.
Thanks.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.